Good afternoon. Today we're going to perform colostomy care. The purpose of this is to assess and care the peristomal site, to collect stool for assessment, and to minimize odor for patients' comfort and self-esteem. Next is to determine the type of appliance currently used and the type of special barrier used to the skin. Next is to review the stoma for the consideration of its color, type, size, shape, and tendency of bleeding and the healing process. For planning, we need first to gather all the materials needed for us for easy access. And next, we need to identify the patient and verify its identity by asking their name and checking the name tag. Good afternoon, sir. I'm your nurse for today. I'm Nurse John, and you are? For implementation, first we need to give the patient's privacy by closing the doors and the curtains of the room. Next, we need to perform hand hygiene and put on gloves. Next is to help the patient to assume the position of choice. It can be supine, side-lying, standing position, according to the patient's ability to move. Next is to unfasten the belt if the client is wearing one. Next, we need to remove the colostomy bag or pouch. Next, we need to wipe the fecal residue using a washcloth while assessing for the stoma and the peristomal skin integrity. Next, we need to place a tissue or a gauze pad over the stoma and change it as needed. For easy and quick succession of the procedure, prepare a skin barrier ahead of time. Use a guide to get the measurement and the size of the opening of the barrier by slightly putting it over the stoma. On the back of the barrier, trace a circle as same as the size of the actual stoma opening. Next is to cut out the tray stoma pattern to make an opening on the back side of the barrier and place it on the bedside for the meantime. Wash the skin using soap and water and remove all the secretions from the skin using a washcloth or a tissue. Rinse the soap thoroughly and blot dry. If the stoma is bleeding, reassure the patient that small bleeding is normal. Continuous bleeding is abnormal after the pouch is in place. Check for the condition of the skin, stoma, and sutures. Encourage the patient to do observations at home. Next, the skin should be absolutely dry. Use a paper to pat dry the skin or hair dryer set on cool to assist for drying. Next is to have the colostomy pouch ready by removing backing from the barrier. Next is to attach it to the skin after cleaning and drying. Hold it in place firmly for 1 to 3 minutes. Next is to apply hypoallergenic tape as needed on the edge of the faceplate over the barrier. Fold the bottom edge of the pouch and clamp. Next is to dispose the old appliance on the appropriate trash bin, remove gloves, and perform hand hygiene. Next, we need to note for the appearance of stoma around the skin and the incision. Next, we need to chart the type of pouch and the skin barrier used in the nurse's notes. Next, we need to record the amount appearance of the affluent in pouch, size of stoma, the color, texture, and the condition of the peristomal skin and the sutures.